There we go. Hello and welcome to our Friday webinar. We are on with Dr. Tom Tully for Ask the Vet, right? Another Ask the
Well,
Vet.
greetings, Laura. How are you
Great.
doing?
Good. Just seeing our participant, it's kind of cool when you hit start, you can see like the numbers tick up as people log in and join us.
Well, well, it's good. I mean, we're looking for good questions as
That's
always.
right. We
And
haven't had a Stump the Vet in a while, I feel. So I feel like we're overdue for a
no,
question.
but I know they're out there because I can be easily stumped. The challenges come in every day. The
That's right. All right. So I'm gonna I'm gonna
questions, but from all of our, all of the patients that we
yes.
have. I can tell you that they make it challenging. And so there's always a reason to say, oh, well, we need to do this. We need to find this out. And so, with that, I do want to thank everybody that donates to avian research to help us advance medicine and surgery that we can utilize to enable their birds to live long, happy, healthy lives. So that's very helpful and much appreciated. I know by me and the other veterinarians that are looking to advance the medicine that we use to treat these wonderful animals.
Oh, that's an important shout out. I'm glad you mentioned that. And then I was going to remind everybody that if you have a question, just use the Q&A button and not the chat. In the chat feature, though, do tell us where you're logging in from because we like to see where everyone joins us. So keep those coming in where everyone's coming from. And I guess yeah, if you have a question, use the Q&A button. I have a question I'll start it off with. Because I was just reading that, with eggs being a little bit more on the spendy side, the more of a luxury item nowadays, that people are rushing to like the backyard chicken thing, right? So you've got people that are trying to not have to buy eggs now instead of just, have their
Right,
own. What
right. We call that grow your own.
grow your own. Yes, grow your own.
You're
So so with that in mind, I mean, like, are there people who should not do that? I mean, is it okay to do with if you have, if you have an aviary outside or birds inside? How does it affect? I know we did touch upon this a bit ago with I think Dr. Lamb, but just a little snapshot of if everyone's getting in on the raising chickens, hobby right now. It seems to be a hot thing going on. Advice for bird owners for.
Well, my advice is just like for anybody that is looking to get a bird, and when you're looking at that like backyard chickens, hens, what have you, that what you see right there is that it's production. You're looking for egg production and to get those eggs. And so, but there's a few things that you really need to really remember. One is to do your homework before you even do anything. If you're interested, find out what's involved with it. Be as knowledgeable as you can as far as what you need to do to be successful. It's not just about buying chickens from the little chicks from the Tractor Supply and going. It's about being prepared, and
Mm.
being prepared is the key. And that's going to allow you to understand what you need to do to be successful. And so that is paramount because with chickens, um, what that is they have a sign on their head that says meal. I am tasty. Okay. And that is for all of those animals out there, all of the animals that eat meat. That's raccoons, coyotes, and also animals that just like, like stray dogs or dogs and snakes, and just it goes on. The snakes could be with the eggs or what have you, but it's all something that keeping these birds in a facility and having a facility that you don't purchase the birds and they're all been killed. Unfortunately, well, that's one of the more common things that we see uh, uh, within a month or two, because these animals are 300, 24/7, 365, looking to get in and get a free meal. And so
Wow.
that's what you have to look at. Doing your homework, it's knowing what's the proper environment for them, the nutrition, what to look for, and then also included in that is with the who if they're injured, if they get sick or have an issue, a medical issue, where will I take them? Okay.
Wow.
And so this is one thing to consider. Also, one thing to consider, you have to think about if you have multiple birds. You have 15 birds, and all of a sudden you have one die, another one getting sick. What you have to consider is that it takes some expertise. It takes sometimes diagnostic testing to assess the patient, to see what you need to do as far as determine what a definitive diagnosis is, and with that definitive diagnosis, or what you believe that the diagnosis is, you can initiate treatment.
Mm.
The problem that you have is that's costly, and it takes time to get those results. And sometimes when you have 15, 10, 8 chickens, that time is not very beneficial in trying to circumvent that disease process. And so you may have other birds get ill. So you need to know those answers as soon as possible. When you have production medicine, sometimes if you have an ill bird or one that's died, is that you need to possibly sacrifice that bird to find out exactly what's going on as quick as possible to save the other birds. That's something that normally doesn't happen with the individual bird, or if you have parrots and you want to save every bird. But with a chicken flock, that could be something that's going to be helpful to try to get the right medication on board, or treatment or diagnosis, so you can know what's going on and get an explanation of it, instead of waiting and then spending the money on possibly diagnostic testing that takes time, and you'll get to the same result on that. So that's a consideration when you have a number of birds. That's what we call production medicine. And if you look at poultry uh, production, if you have these large companies that have egg layers, or like Tyson, anything like that, Purdue, they will, if they have their facilities where they have hundreds or thousands of birds, if they have a bird die, they're not going to treat it. And usually they don't treat the whole facility either, because that's too costly. But they will take that bird and they would get a postmortem examination, pathology examination, run the test to get the information as soon as possible. So this is a consideration. Now, I will say, I don't care how many birds you have, but if you have a bird, you say, I want this bird, I want to save this bird. Well, we'll do everything we can to save it. but we'll get I guess people that have these birds that die or sick, and then it's one of those things like, I want to know as soon as possible. Or they have other birds that are susceptible or exposed that could come down with it. And I would say that if you do have a problem with the backyard chickens, that you have one that dies for you don't know why, to try to get a post-mortem examination on that that bird. And always remember, don't put the bird, if you're going to get it examined, a necropsy, which is the term of pathological examination on an animal, which is synonymous with an autopsy, where the human examines a human, to make sure you don't freeze the animal. Make sure that you just put it in a sealed bag in the refrigerator. You don't want to freeze the animal because that disrupts the tissue. And so that's something to definitely consider when you have these birds. And if that happens, if you don't know why the bird is behaving this way or died that way, and so the sooner that you can get it in to see a veterinarian to get a diagnosis, the sooner that you will have an answer, okay, to treat or understand what's going on. With treatment, if you have a bird that has a leg and the chicken, it's called Merrick's disease. Unfortunately, there's nothing that you can do with that bird, but for your other birds, knowledge of what that disease is and what you can do to reduce the chance of having it on your farm may not be anything if the other birds aren't vaccinated, but at the same time, knowing how to reduce that from occurring in the future with new birds, getting vaccinated birds. So it's been my experience that a number of times with people that have kind of production animals, even backyard birds or what have you, that a number of birds have to die before they finally see somebody to try to get an answer. And so if you don't know why the bird died, now naturally if a dog comes in and unfortunately kills the bird, you know what happened there. But if it's unknown, that's when you need to, the sooner you bring it in, the better you are on that. So those are some, knowledge is key. Knowledge is key. And so knowing what you're getting into at the beginning reduces the chance for surprises in the end.
Okay, you gotta be, it's gotta be study up, right? Before you.
Yeah, but it's fun, and you get, if you have the birds, you get fresh eggs. And so, people say, well, fresh eggs taste better. So
There you go. And your birds, I mean, birds can have eggs too, right? So if you have parrots, you can give them a little bit of scrambled egg. All right. Do you have a question about walnuts? So they want to know, do walnuts used as a treat reward, are there heart benefits as they do in us? So the heart benefits that we reap from eating walnuts, do our birds get that if we use it as a
reason that sounds familiar, like walnuts, like we maybe had that question last time. I'm not sure as walnuts are concerned. As far as walnuts are concerned, I don't, the question was just as a treat or something like that.
Yeah, if can they give some healthy heart benefits to our birds if you give it as a treat? Is it a healthy treat, I guess, and does it have benefits to
Well,
their
the one thing with nuts in particular, I don't see anything wrong with giving them as a treat. And if we're talking about English walnuts in particular, an English walnut as a treat now and then, is not going to be a problem. I think that of course, there's a high oil content in most nuts, and how that affects the bird, depending on what nut it is physiologically. Some more, some less. It's just like pecans or pecans, as also pronounced in other parts of the country. But and they're native to where we live, and they're a lovely nut, as far as the taste is, for me. And so we had a free flying macaw in our town, and it was a green wing macaw, and it'd like to go into pecan trees when the nuts were in the fall, right? You couldn't, you know where it was going to be, and it did, it did fine. And how well, and of course it wasn't like, well, you can only have half of a pecan, you can't have any more. It had the whole tree, right? It did well. And how it may have over time, who knows what effects it would have had, or did have on the bird, but it was older, free flying macaw. So, like I said, I don't think, I wouldn't necessarily say it's you're going to have enough of the walnut to provide a heart healthy contribution to the bird's diet. But I don't think that nuts every now and then as a treat are okay. It's just like I've mentioned before about hyacinth macaws and macadamia nuts. The problem is that they divert. All I want is macadamia nuts, and I'm not going to eat anything else. And they train the owner to only give them macadamia nuts, and they have no B12, and that goes for Brazil nuts. Also have no B12, so you run into the risk of having an anemic bird because of the lack of vitamin B12. So too much of anything is not good, and I've mentioned that before. But just speaking of that, and like I said, I don't think that necessarily you're going to get the amount of nut. I wouldn't recommend that, say, would give you the heart healthy benefits, but it's not gonna. The birds will like it and enjoy it.
Yeah. Okay. Yeah, they like it. Okay, so we have a question. All right, here we go. I hope I pronounced everything correctly. They want this is from Conrad, wants to know how great is the risk factor for a parrot to contract bacteria like Pseudomonas aeruginosa or E. coli and become infected and seriously sick from someone who has cystic fibrosis and cultures these bacteria regularly. And then they follow that up with they use a good air purifier. They wash hands before and after handling the bird and the food and water. So they keep the cage clean. They refrain from kissing or sharing food with the bird. So can the bird get sick from someone who's cultures the bacteria regularly for?
Can the bird get sick from it? Theoretically, they could, if the bird's immunocompromised, and that's the one thing that we always look for, and always stress proper nutrition, proper environment, to make sure that bird's immune system is functioning as well as it can. It's similar to what we say, that age doesn't age, the students are taught, not necessarily by me, but I hear it because I always ask, well, how old's that patient? How old's that, that comes in with a problem, and well, how old is the patient? And the students always remind me age isn't a disease. Okay. However, if you go to physicians' offices, who do you see there? Do you see mainly middle-aged people, young adults? You you go to pediatricians, you see children, but most physicians, it's old people. Okay. Now, age isn't a disease, but it does affect your overall physiology as for your functioning just diminishes as you age, and you do everything you can to prop it up, but at the same time the immune system, that's why it's like, well, why are these diseases, why do they say you're more, they're more, I guess, severe in older people, respiratory diseases, and why do they have these, protection against this, or you should watch out for that, because if you're over 55, you're more susceptible, over 65, more susceptible. And so that's why. And so in general, if you have the bird, is healthy, and we use the term healthy because it's everybody has a definition of healthy, but let's just say it's immunocompetent, everything, with the immune system's well, nutrition, then I don't think that the bird's going to have any more of a risk because of these organisms, that may be being with another person within the room. When you're looking at infectivity, you're looking at two things. An organism. Is this organism what we call pathogenic? Is it really, say like when COVID first came out, it's going to infect somebody and kill them. So, or cause severe illness that they recover from. But anyway, it's gonna do that. If the organism's very pathogenic, and that it doesn't take many. So it doesn't take many organisms to cause infection or cause disease condition. If it isn't, then of course it's going to mean that it'll take a lot of the organisms to be exposed to possibly cause that infection if it's not a very bad bacteria or organism. So you have either a small amount where it's really bad or a large amount when it's not so bad. And so those are the kind of the two things that you're looking at. And then what you have to look at is exposure. Now, this question, the question that we had, the owner goes, or the questioner says, well, I refrained from kissing the bird or whatever. And anything that person can do or you can do to reduce exposure is going to reduce the chance of infectivity. Is it possible? I mean, we have cultured just about, I can't even name all of the bugs that we've cultured over the years, but at the same time, it's a lot of them are in the environment. And why aren't we getting infected every day, all the time? Because of our immune system, right? Or we're not getting exposed. That's why we wash our hands or are careful with that. So what I would say is that that is that's a great question, But I would say that keeping your bird, its immune system as competent as possible, and reducing exposure, and that's going to that the bird's not going to have any more of a chance of being infected with those organisms than any other time. That would just be my thoughts, and that's kind of gave you a little kind of background on why I believe that.
Okay. That just makes me wonder, like, do vets follow certain protocols when you like leave the clinic and you go home to your flock? Like, do you
I mean,
and
that's one of the things that you have to consider if you have had exposure to you know, an organism that's easily transferable, and, that it doesn't take much for that organism to that the birds are highly susceptible, that you would definitely we I can't speak for everybody, but you don't want to interact with the birds in kind of an all in, all out. That's somewhat similar to what the poultry industry does. I mean, you don't go from one farm into the next farm and wearing the same things. I mean, a lot of these you have to take a shower before you enter the building and put new clothes on before you enter the building, and take them all off when you leave the building.
wow.
Um, and so that's kind of standard poultry protocol for entering poultry houses. Yeah,
Wow.
yeah.
Wow.
So that's all under consideration. And also, what's under consideration is if you have a patient that comes in, changing and whatever you need to do, depending on um, what the organism is, or what you suspect the disease condition is, on that. Yeah.
Okay. Okay. We have a question about a citizen exhibiting symptoms of advanced hypovitaminosis. So a caseous discharge, or soft, thick yellow pads on the feet, on the soft, thick yellow pads on their feet. And once the bird is on a beta carotene rich diet, how long before is it the caseous discharge ceases and the foot pads regenerate? So talking about a foot pad issue here. Not
Okay.
sure.
Okay. All right. All right. So what they're describing is a kind of a purulent, kind of pus, if you will, from the bottom of the feet of the bird. And so, with that, what we're looking at is uh, a term that's called bumblefoot. And that's from what you described, Laura. That's what I'm gathering. And with bumblefoot, it kind of led off the question with, well, the hypovitaminosis, I think was what was mentioned.
Yep.
Uh, and so when we're looking at bumblefoot, it is one thing, and we need to define that. And then what we also have to discuss is we have hypovitaminosis, and that's another thing. And then in the middle, we put them together if we, to see what's the connection here, and why is it kind of put together in the same question. Well, hypovitaminosis, and when you're looking at somebody saying hypovitaminosis in birds, what you're mainly looking at, and usually when somebody says that, if it relates to the skin in particular, is got a hypovitaminosis A, although other vitamins contribute to the skin health. And so that vitamin A can involve the skin cells, the epithelium, or the outer layer of skin, and also cells lining the respiratory and GI tracts, and among others. And of course, you're looking at eyesight, vitamin A, eat your carrots. But that's where you have hypovitaminosis. So if you have I think the term comes from, and I'm just kind of giving my thoughts on this based on the question, that the bird was lacking vitamin A, and then so developed this lesion on the foot. Now, then you get into what's the bird eating. Okay. And so what is the bird eating that would cause it to develop hypovitaminosis A, or just a low level of vitamin that would result in this foot lesion? And so that's the one thing you have to look at. What's it eating? And it's been stated for years that all seed diets would cause hypovitaminosis A, and in particular, if there's only one seed, that would the birds were being fed, just say a millet seed or something of that nature. That's just been perpetuated, whether how true or factual, it's kind of been accepted in a manner that would cause hypovitaminosis A. But with pelleted diets and with supplements being available, it's been circumvented, because the pelleted diets have impregnated vitamins in there, and so that shouldn't be an issue. And
Oh,
what's
sorry,
that?
I have an update on that question. The caseous discharge is in the choanal slit on the bird, and the soft yellow foot pads are a different bird. Both are vitamin A deficient. Sorry.
Or what's considered vitamin A deficiency. Okay.
Yeah.
So the choana is the respiratory tract, and I had mentioned that hypovitaminosis A could affect the cells lining the epithelium, and if they're disrupted, then that would make them more susceptible to bacterial exposure and then infection, which would possibly lead to tissue reaction in the form of this caseous material, or kind of pus-like material. So that's how the hypovitaminosis could relate to these conditions, and or contribute to it. However, it's not necessarily of course, like I said, you have to assess what the diet is, and is it are they getting what you would consider the best nutrition to meet the needs of the birds. And as far as nutrition is concerned, I've mentioned already that most of the species of birds, there isn't a daily recommended requirement known for the species of birds we treat. Very, very few, and probably can count them on one hand, that we have as far as our citizen species or parrot species are concerned. And so with that, we do the best we can and extrapolate. And that's taking it, so we know what chickens are, we know what that is, or we know what cockatiels recommended requirements are. So we extrapolate to other birds. But so we do the best we can. That's why diverse diets to try to enhance the ability of providing birds with adequate nutrition increases of meeting those demands. Because you look at the diversity of most of the species, what they eat, it's pretty impressive. And so the pelleted diets actually have the vitamins and minerals impregnated, so you know they're getting that. And then also, if you have some supplementation on top of that, then you're doing pretty good. And so that would help reduce the chance of having this deficiency. So you have to look at the nutrition. Now, with the foot pads and the choana, the choana is the oral nasal interface, and the dorsal roof of the mouth is where the sinus comes and interfaces with the oral cavity, and can have a direct kind of a connection to the trachea when the beak's closed. When you're looking at that slit in the upper part of the oral cavity, then what you're looking at that is possibly a sinus infection if you have drainage or any kind of purulent material there. Can a hypovitaminosis itself cause it or contribute to it? This presentation? Yes, it can. Can a sinus infection occur without hypovitaminosis and just with a pathogenic bacteria or infectious organism? Yes, it can occur, and even if it doesn't have hypovitaminosis A or a hypovitaminosis condition. So I would say that you'd want to make sure that they are receiving the proper nutrition, but at the same time, the foot pads being smooth, that can happen without a having adequate nutrition. Because and so keep that in mind. And the one thing is, if this occurs, if you identify what's causing this purulent material, you can look at looking at cytology, taking a sample or culture, and finding out if you can identify any organisms in there that may be associated with it. If you think it's a sinus, you can do they can get an aspirate of the sinus that's more, where you get less, less possibility of getting contaminants or commensal organisms. And then they have the next generation sequencing that you can do now to try to identify organisms that are difficult to grow on traditional auger plates. So that infection can occur with just like we can get respiratory infections and have adequate nutrition. So I want to keep that in mind. Now, hypovitaminosis A can contribute because it can make that cellular protective layer. It can compromise that because it's not as healthy. And so it's easier for those bacteria to infiltrate and infect the bird. The foot, a little bit different story. Of course, if the epithelium or the skin is not as healthy as it is because it's not getting adequate nutrition, then it would increase the chance of having abnormal, I guess, presentation, a smooth area on the bottom. But other things can cause this, and so that if it isn't that kind of rough appearance of the bottom of the foot, and it's smooth and in places where it shouldn't be, then a couple of things. Of course, you look at the nutrition, see if that may be a contributing factor, but also what you look at is perching. Because if you look at the bottom of the bird's foot, there's not a lot of cushion there. The cushion that's at the bottom of the bird's foot is strategically placed. You have little fat pads, really. You have little cushions over prominent areas of that foot, over the joints and over the ends of the bone, but it's strategically placed, and between that is not much. Now, if the bird is on the same perch and perching at the same, the same part of the foot is on that perch, and all of the weight is on that area, then over time, that is what we call you can get pressure necrosis, or a deadening of that tissue, because it's like bed sores in humans that can't move around, and the pressure is always on that spot. And so that's basically what you get on the bottom of the feet, little feet bed sores, okay? And so it starts because the pressure reduces the ability of that skin to get blood supply. And as that skin doesn't get blood supply, then it thins, because it's not as healthy. And that's when you have the thinning area. And especially if the bird is overweight or the perches are improper, that's why we always recommend natural wood perches with different diameters, so the bird isn't always perching on the same area of the foot. And that helps reduce the chance of this pressure necrosis and the thinning of the foot. And when I mentioned bumblefoot at the beginning, this is kind of a common term that's used for these foot sores. And really, a grade 1 bumblefoot is kind of the thinning or the smooth area of the foot, and they can go up. And there's been different grading scales of it, but I think we're kind of 1 to 5, with 5 being where it's an infection and it's involving the bone. Because what happens is you can have these thin areas of skin on the bottom of the foot that all of a sudden they're not as protective, and then also they're weaker than the normal skin, and then over time thinner, and then with the foot movement, they crack open. And then when they crack open, of course, there's an open wound on the bottom of the foot. It could be slight, but it doesn't take much for a bacteria to enter that, or for it to try to heal itself with constant irritation because of the foot perching and lack of blood at the same site. And then it gets worse, and then it becomes infected, and then the infection goes from the tissue to the bone, and it is a very difficult wound to treat because of the location of the wound and what you have to do on that. So you mentioned hypovitaminosis. It's a great question, because as with most of these questions, it's a little bit more complex. And two things that you mentioned, they can occur without having nutritional deficiency. Now, with nutritional deficiency or hypovitaminosis, A in particular, that can increase the susceptibility to these. But in and of itself, given proper nutrition and making sure that the birds have adequate and perches that are natural and wood, where you have varying diameters, and within that, like a branch type of a perch is going to be essential, and to try to reduce the occurrence, whether it's a nutritional deficiency or not. So, great question.
Okay. Yeah, we got another one about, where does it go? Okay, so they have a 2-year-old foster budgie, who has an upper respiratory infection. They've
They
taken
have what's a 2-year-old, what kind of budgie?
a budgie. They're fostering it. So
Oh, a foster budgie. Okay.
foster budgie, yeah. So they've taken him back
That's
to the,
great. That's
I
great.
know, foster budgie. I love it.
Yeah, that's great.
They've taken him to the budgie, or to taken him back to the vet twice since he was diagnosed, but he has been breathing through his mouth, and both times his lungs were clear when he was examined. Is this typical of budgies with upper respiratory infections? That's the question. Also, if it is, what are other things they should be looking for as evidence that the infection has spread to his lungs? He's on Baytril. He's got 0.1 milligrams twice a day, and he's in a hospital cage. So what do you have? What advice do you have for this little ledgy fighting a what appears to be a upper respiratory infection?
Well, the um the one thing that it seems like the birds being cared for and looked at. Like I said, I commend um, the questioner for their fostering of the little budgie. The one thing that I would want to know is, how do they know it's an upper respiratory infection? Now they mentioned the lungs were clear, but then again, that's not upper, right? That's lower. So that, I guess that was just to say, well, I don't believe it's the lungs. Then it's like, well, is it what denotes an upper respiratory infection? And so in my mind, if you have and again, there's different things in the choana. We try to kind of simplify it a little bit for the Ask the Vet session. There's different things that can cause, as the owner had mentioned, or the questioner had mentioned last time about the purulent material in the choana. It could be more localized and not within the respiratory area. But the choana can be somewhat of an indicator if you do have an upper respiratory infection, whether you have any discharge or not. Is it the issue here with the budgie, fostering budgie? Usually, you don't know the age or whatever. Is it a respiratory issue that the budgie has? Upper respiratory is not that different than what you have with humans with respiratory, although you don't have a lot of birds going around coughing and sneezing. They do to a certain extent, but not as humans are. But the nasal discharge is another thing that we will see with upper respiratory infections, and various forms of that. So the one, so is it difficulty? Is it difficulty breathing? Is that the only thing? And is that the only thing? If it is an infection, the question is that you have little budgies, and so little budgies, they can weigh anywhere from, I think we had, I can't believe we had like almost a 50 or 60 gram budgie. You just don't see those very much, but the typical budgie usually weighs between 30 and 40 grams. Okay. And so where I'm going with this is that usually to kind of detect what the situation is we need some kind of a blood parameter, and that's where I had mentioned the CBC. And if you have a 30-gram budgie, of course, you're looking at really 0.3 milliliters of blood. So that's not very much, but you can get some information from that to determine if there's an inflammatory problem going on here that may be associated with a respiratory infection. I'm not hearing any type of upper respiratory signs that are associated with it.
So I have a follow-up. Sorry, like another at the foster veggie. So the vet could hear something through the stethoscope when he placed it on his forehead, and he does appear to have difficulty breathing, which is why they brought him back twice.
Okay. Well, I don't know what he could be hearing with the stethoscope on the forehead, but nonetheless, what I would say is that the blood work is something that would denote if there's an inflammation going on in corresponding to an infection. Just saying that, and that would be helpful when you have very little blood that you could take. The second thing that I'll mention about budgies and birds in general is that there's a lot of things that can occur with birds that will result in kind of what we call dyspnea, or kind of a respiratory distress, or having trouble breathing. Okay. And so with that, you say, well, what could that be? Well, birds don't have a diaphragm, and they have air sacs. And so if there is anything within those that's compressing those air sacs, then it's going to result in the bird having somewhat of labored breathing. And that would be, so what could that be? Well, one thing that commonly occurs in budgies is tumors. And so tumors within the body. And so I don't know if the little bird has had radiographs or what have you, but many times, if you have birds that have an enlarged liver, if they have budgies in particular, it's not uncommon for the budgie to have a liver tumor that is enlarged and causes distension of their what we call their coelom, or what kind of analogous to humans, the abdomen. And so if it's pooching out, then that's kind of liver is compromising the ability of those air sacs to function properly, and it results in respiratory condition, kind of a labored breathing. And so that's one thing that I would check for in particular. And then also, if there's fluid, fluid can be associated with any, a number of different disease conditions. But if fluid is within that coelom, then that can again compromise the function of those air sacs, which would result in the bird having a labored breathing on that. So those are just kind of two situations. And then, of course, egg. But an egg, if this is, I don't know if it's a male or a female, but it's been going on for a period of time. And so I don't think it is. But that is one thing that could cause that labored breathing. And one other thing that can kind of present as a respiratory problem that is not that common, but they can get kind of a urinary or fecal secretion, almost like a constipated state, and the birds will have vocalize like when they breathe, or have respiratory labored breathing with what we call fecaliths, or a fecal stone, or a urolith, kind of a urinary stone, that because within that cloaca, or just inside of the vent area. And so they can, almost sound like they have a respiratory sound, but it's not respiratory in nature. It's in lower GI. So keep that in mind, that labored breathing doesn't always relate to a respiratory condition, but it's affecting the I mean, I guess it is a respiratory condition, but it's not necessarily a respiratory infection. Uh, it's more of a compromise because their respiratory system is so efficient, and if everything is not functioning as it should, then they're not going to necessarily have the same a normal breathing pattern. So keep that in mind with this little budgie, that to make sure that one, they can do, like I said, the complete blood count to look and see if there's inflammation, because if there is an inflammation, it's less likely that it would be something that in the lack of clinical signs with that, because you can get noises and sounds. Auscultation for birds is not, for me, it's not very helpful. Well, I don't normally go on the forehead, but even when I go where the lungs are between the wings and auscultate the bird, it's just like the bird's lungs don't have alveoli. They don't have little balloons like we do, where the lungs expand and contract and expand and contract. They have air capillaries. And so they have a flow through mechanism for their blood, their airflow for oxygen exchange with the blood. So they don't need to expand and contract like a balloon, like our lungs. And I'm thankful for our balloons, but air capillaries would be much more efficient. I'd probably run better. But the thing that you're looking at is that a lot of the sounds that you get on auscultation are associated with the expansion and contraction and the function of those balloons for humans in our lungs. And so you don't have the opportunity to get as much information. I get a lot of information just listening to the bird breathe. And so that's just audible listening to the bird. But nonetheless, if there is sound being made in light of and then also looking at the getting an X-ray to see if you can see any enlargement of organs or what have you, and then also palpation of that, or feeling at that distal abdomen area. So
Okay.
very good question. Thank you. Because a lot of times things aren't what they seem they are, and so it appears that the medication isn't being effective. And if it's something other than, say, a bacterial infection, then that medication ain't going to work.
Okay. Maybe we have time for one more question, just real quick. It's from, if you have time, I don't know if you have to run off to surgery or not, but it's
Yeah.
okay. It's a 45-year-old Gotham's cockatoo, has a large grape-sized mass on the side of her neck, between her neck and her shoulder, that's grown over the last month. So initially it seemed to have some trouble eating, but there's less trouble now. It doesn't seem to cause her any pain. Any ideas, or what how should they address this 45-year-old Gothans?
What about growth rate? Is it increasing in size?
Um, it's been growing over the last month. So at first it seemed the bird seemed to have some trouble eating, but doesn't have as much trouble. It doesn't seem to have as much trouble now. And it doesn't seem to be painful, but then again, it's something that's growing. But it's been growing over the last month.
A
It's
lot of
about the size of a grape.
Yeah, on a Gotham's cockatoo, that's fairly significant. The one thing that I would recommend, I'm very I'm conservative on these, and usually when I think of my patients, I think of myself.
Mhm.
When I want a grape growing on the side of my neck, and I would want to know what it is. And so my thoughts are is there's a simple test they can take a needle and aspirate some of the cells within that or the contents. It could be fluid contents in that, and um, or it could be um, a reactionary cells to kind of an irritated area on the neck. But they can identify what it is. Once identified, then you know what it is, and then what the recommended plan of action would be. Naturally, if it was an adenocarcinoma or some type of a form of a neoplasm that would be very aggressive, you'd want to remove it. If it's a lipoma, then a fatty tumor, you may say, well, we'll watch and see what it does, and see if it continues to grow quicker. And of course, if it's a some type of an abscess, you would want to remove that.
Yeah, I have
So
another update about it, by the way. Sorry, I have these updates during the question. And it started as a small grape and now it's a large grape and there's no known injury, no open areas. It's firm and seems fixed, so it's not movable, not palpable.
yeah, yeah, you need to find out what that is. Yeah, as soon as possible. Yeah, yep. That's
Okay.
my recommendation. Get it, find out what it is, and then once you find out what it is, then recommendations can be made to try to resolve or treat it the best that can be done. Yeah,
Okay. All
yeah.
right.
That's a strong recommendation.
Okay. That we got through some pretty detailed questions there and the follow-ups were helpful, right? Like
Yes,
the,
and thank everybody for the follow-ups and the questions. They're always good. Excellent questions again. And we touched on things that we haven't touched on, and it allowed, I guess, a little bit more in depth on some of these to get a better understanding. Because sometimes, like I said, it may be respiratory presenting, but it's not a respiratory I mean, it's causing a problem with the respiratory tract, but it's somewhere else. It's a tumor
yeah.
in the liver, and something like that. Yeah.
I,
So
I was kind of the do they normally put a stethoscope on the forehead for respiratory with that from that little budgie?
I haven't. I mean, you'd have to ask. I,
Okay.
I I don't know. I don't know.
Okay.
I haven't. Uh, I, I haven't. I haven't done that.
All right. All right. Wow, that was I think that's we got through our questions. So if we didn't get to yours, we'll try our best to get you an answer. And so I have to announce real quick. So next we're on with you, I think in May. Is that right? When are we doing next?
Yes, I think. Yeah, May 2nd. May
Okay.
May 2nd.
All
Uh,
right.
yeah. Mm-hmm.
Whatever that Friday, first Friday in May. Um,
Yeah. Yep. The first
okay.
in May.
So
Yep.
we'll have a little because we got the spring break coming up in April and travel and stuff. And so I was just gonna remind everybody that next Friday, and actually we've got Lisa on with us today. She's filling in for Brenda behind the scenes here.
Yes,
Um,
thank you, Lisa.
so we got Lisa, who's gonna be a new series next Friday. I don't know if Lisa wants to chime in because she's actually the one hosting it. But she'll be presenting what and it's also marks our 5th anniversary, our 5-year anniversary of doing these webinars. And it'll be a new series, Parrots Past and Present. She's going to start out starting out in the 70s. So she's going to give us a walk through history there.
That's
And
going to be interesting. I would, highly recommend.
I'm
Yeah.
sure we've come a long way. At least I hope we have since then.
We
Yes,
have
we
for
have.
sure.
We have a long way to go, but we've come a long way.
Yeah,
Yeah,
it'll be
a
interesting to
long
see
way.
how far we've come.
Yeah.
And also we're gonna since it is our special 5th anniversary, we're gonna have a giveaway. So there you go. New episode, new some giveaways. So please join us. That'll be next Friday. And yeah, 5 years of doing this. Imagine that. Who would have thought? I can't even remember. You're like on like your 200th episode or something crazy with us. Like you have like it's
Well, I mean, it's because people have great questions, and I mean, it's like, I mean, it's because of our attendees that we're keeping, that we keep going. Without them, this wouldn't be
absolutely.
happening. So thank you, and we all learn, as I always say, we all learn.
For sure. That's why we do this, right? And thank you for your time. I mean, I know you're out saving birds there. So thank you
Well,
for
that
joining
and
us.
teaching new avian
And teaching the
veterinary.
future. Yeah. So you're teaching like the next whatever, like we're looking back at the 70s and you're teaching like the 2000s,
Yes, I'm
70s
teaching,
coming.
those going into the middle of this century. So there you go.
All right. On that note, I want to thank you, Dr. Tully, again. Thank everyone for joining us. Hope to see you next Friday for our special 5th anniversary. Until then, everyone stay safe. Have a wonderful weekend and all the best.
Thank you, Laura, Lisa. Thank you so much. And thank all of our attendees and questions.
Yes. All right. All right. Bye, guys.
Bye.